You've got a different breed of patient. I mentioned a little bit this morning, I kind of mentioned the hemp skirts. I was exaggerating a little bit, but not entirely. These folks come in, they look more mainstream now than they did years ago, but they're into health. They really are. They're going to have a lot of times natural fabrics on. They're going to have no hairspray, no makeup. They're into more health regardless of what they're wearing and what they're eating. And I used to call them the kooks and the crazies because that's really what they seem like to me. And at first, when they came in, I didn't know what to do with them. I mean, because we were weird. I mean, they really were, and they probably still are, but I become weird, so I kind of relate to them better. But they'll come in with a million questions, and mostly what they're trying to do is make sure you know what you're doing, because they have been to many dentists before, and they say, yeah, I use rubber dam, and I use low mercury, all kinds of stuff. They see right through it. If you don't do this correctly, they're going to know it immediately. And if you don't have answers for them, they're going to know it immediately. And they've been through everybody. They've been to physicians. They've been told they're crazy. It's all in their head. And this is sometimes their last chance. So we spend more time on these people because it takes more time. They have more questions. And they could be there 2.5 hours sometimes. It's not with me necessarily, but it's with the assistants. I'm in there doing the exam. Everybody gets the same exam. Everybody gets the same treatment. I don't care if they're mercury patients. I call them mercury because they're coming in for that reason. But, even my just bread and butter patients live in the community. They're going to get the same treatment they get. But be prepared to spend more time with them because they're going to demand it. They really are. But they're worth it. These people are so appreciative of what you do. And they bring you cookies and they hug you, and they're so happy to do testimonials for you. I mean, it's really a different group of people, and it's rewarding for me personally to do this for them because I feel like I've helped somebody. Dentists get down, they do this beautiful onlay. Who cares? The patient knows if it hurts or not. With this, these people are really appreciative of what you've done and how you've done it. So be prepared for that. And the other thing early on I was kind of put off by is because of my own ego, is that they knew more than I did. It was like, how dare you know more than I knew about dentistry, But in fact, they did, and that's cool. It made me learn more. So I think I know as much as they do now. And they're very environmentally sensitive sometimes. Perfumes and fluorescent lighting and stuff like that. You don't want to wear cologne. You don't want your assistants to wear perfume. You don't want to be scenting your office. You got to be careful with that kind of stuff because they're very sensitive. And it's not in their head. They're super reactive to things, many of these people, because of the mercury in their gut, the candida, and all the things going on. Stuff that doesn't bother you and I devastates them. And it's not a joke. They're not just wimps. They're affected by it. Some of these people haven't worked in a long time. They're really sick. And a lot of folks come in referred by the alternative physicians with either MS or Lou Gehrig's or some other neurological disease. And then the physician tells me what they want done. Okay, do a quadrant at a time, do it 2 at a time, do 3 at a time. I send a report back to them telling what we're going to do, and then we kind of work together hand in hand on that. So it takes more time. Don't charge the same. You've got to charge more because your time is worth it. Okay, as I said earlier this morning, many times diagnosis of fibromyalgia or Lou Gehrig's disease, arthritis, headaches, chronic fatigue, Lyme's disease. I don't know about where you live, but North Carolina got a lot of Lyme's disease. Patients they're just better diagnosed than they used to be. Lyme's disease can mimic MS. There's a lot of stuff going on with Lyme's that we don't know about. And as far as I know, there's no treatment, no effective treatment for Lyme's disease. But they come in with a hodgepodge of problems. And are unable to function many times. Come in with a husband or a wife. I said it takes more time. Your overhead's higher. Charge appropriately. I don't know exactly what, and Joe, you and I ought to figure out what it costs to equip our new offices because it's been a while since we've done that. But when you buy the different vacuums, of course, the dams you've got and the little clean out, the ionizer and mercury separator. I don't know if you'll spend, would you have a guess, Joe? I don't know if you'll spend $20,000 to do that. I don't know. But if you're a CERAC dentist, $20,000 is nothing. You go get geared up for doing implants, that's nothing. So it's not insignificant. But what I did, I was telling some people at lunch, I started slowly. Each time I went to them, of course, we didn't have all this armamentarium 15 years ago. We've added on. I was starting to do a couple things each time. I didn't buy everything at the first meeting. I acquired it. But until you get it all set up, you really can't treat these people effectively. They're going to know it. And they're going to know. They come in from the internet. That's who knows what's going on. Initial exam, like I said, they could be there 2.5 hours. Every patient is treated with the same protocol. We don't distinguish between, because we're protecting us. That's basically what we're doing. The patient's getting the benefit of my staff and myself protecting ourselves from mercury. Yeah, so we always protect ourselves. This is a Clifford test, and this is a reactivity test. The physician draws a blood sample, spins it down, sends the serum in to Colorado at Jeff Clifford's lab. And there's other companies that do this. And what they do then is they do an assay on antigen antibody thing, and you'll get a report like this. I think there's 3,500 products, maybe 4,000 dental products. And then it'll give you an N or an S, depending on we can use it or if you can't use it. And we go through, the assistants go through this and mark what we can and can't use. It's becoming now, most likely, the products we're using now, rarely do we have a problem with reactivity. You know, used to be we really had to hunt and peck, but now it's boom, boom, boom. Once in a while, there'd be some crazy thing like you can't use this etch. I don't know why. You know, phosphoric acid is phosphoric acid, but you know, we'll move over to a different etch that they can have. But it's pretty much, if you're using the products that we've been using for the last several years, it's not a problem. Now, this test costs somewhere around $250. Takes a couple weeks. The patient gets a copy. We get a copy. And, you know, I don't know how long it's good for, but, you know, once we get, we're going to get this work done in a couple months or something anyway, so it's probably good for a couple years, but there's some information on that test. And you'll get these slides, by the way. There's been some confusion. Joe and I did not realize that our slides weren't in your packet, but we're going to get them to Kim, our executive director, and Kim will get them out to you guys. So you'll get a copy of all this, so you don't necessarily need to write all this down. Although I know it's very riveting and you want to. Yes, sir.
One more time, though. So your office protocol is when you get that back, you highlight the ones that you use? Or
Yeah, that we can use.
that you can?
Yeah. Because it comes back with an N or an S.
I know we use them a lot.
No, N or S, or was it?
Pages long, so.
Yeah, is it N or S, or is it N? Suitable or not? Yeah, okay, that's it. Yeah. But like I say, with Voco, with Cerac, Emax, and the other, what was the other, Procad, just once in a while we find something, but not very often. Used to be, we had Herculite and a whole bunch of different products in the office. It was really a chore to go through it. And we only use one bonding agent. Well, we have two or three, but 99% of the time we're going to use this one thing. And it just, we don't have a problem like we used to. Either the products have gotten better, or we just gotten to the point where we've eliminated stuff that people are always affected by. Another company doing the same thing, but the testing. Either one of these companies will treat you well. And this is just some marketing that we do in hand. I mean, this is kind of silly stuff. These are books that are offered through the Academy. You can get these. Some of these are a little bit dated. We've just kind of come up with a new one. I don't know if it's out yet. But Michael Ziff's book's just being rewritten or has been rewritten, which is really a good book to have. And I don't see it. I guess it's that center one. No, this is the one it is. I think it's this one that's being rewritten, Dentistry Without Mercury. And these are some other ones that the Academy has. This book, Fluoride Deception, David's going to talk to you about that more. That's an excellent book if you want to get the history of the fluoride war, how it's got started, how it's tied into the nuclear industry, the bomb industry, and the phosphate industry. They basically had nothing else to do with the fluoride, so they sold it to dentists. These are brochures that the Academy has that you can get. Some of us have been talking about ozone. We got a brochure on that. And dental fillings. These are designed for patients, obviously. As I mentioned, these patients are the cookies and hugs. And some of the advantages is increase in your patient pool due to your unique selling position. I lectured to a marketing group about that very thing, a unique marketing position, because people will come to me from 5 hours away, and there'll be another dentist or two that does what I do in the same distance they've traveled, and they found me because they found me on my website. So the website is extremely powerful. That's where these folks come from. When I advertise in a local magazine, or I advertise on TV, or I do a radio spot or something like that, or I used to do a radio show, those people come in for just regular dentistry. They want cosmetics, or they got a broken tooth, or blah, blah, blah. But the internet specifically draws in folks who are knowing what we know, and they know what they're talking about. So, kind of is a unique selling position because not everybody does it, and they want it. They'll travel for it, and they'll pay for it. Staff retention, I guess it's my magnetic personality or the fact that my staff wouldn't want to work for another dentist because they don't practice this protocol. So it does kind of create a homogeny in the office, and the staff appreciates what you're doing because they know you're doing it for them too. It's just not about the patient. Patient's really this third person in the road because they're only there for a couple hours, and we're there all week, all year for 35 years. So it'll be a long time. And you're perceived to be an expert in excellence. Increased caring level with your patients because they know you're doing this for a particular reason to make them better. It's a lot more fun to remove, quadrants of mercury on a patient than it is just, fix a quadrant of teeth. You feel like you're helping somebody and improving them rather than just making them prettier, which I don't mind doing either. Okay. And they're more receptive to the treatment plans. We were talking at lunch. Somebody was asking me about increasing your fees and how do you do that and all that. Increasing, this isn't a management course, but increasing fees is not a big deal. You just do it. I never have anybody come into me and say, wow, man, you charge a lot for an onlay, unless it's just somebody from the community who's just coming in to me as a general dentist. But folks coming in doing this, as Matty said earlier, they're not complaining. Matty said last night he's never had anybody complain about his hazmat fee. You'd think $345 per session. Somebody would go, well, I'm not doing that. Never said a word. And I never have anybody question me. The only question is, how soon are we going to do this? Are you want to get it done in 6 months, 2 months, or a year? It's up to them how fast they do it. But, we don't have a problem charging them, and they don't have a problem paying it. And a lot of them have insurance, a lot of them don't. But, you got to get paid for what you're doing. They pay cash many times because they don't have insurance. And they'll find the money. And it's not all about the money, don't get me wrong, but that isn't a bad side of it either. Healthy retirement, at least I'm not going to die of mercury poisoning. Increased patient perception of excellence, we talked about that. Increase in practice income, for sure. In my office, our income, where we share the productivity, it's spread amongst the employees, so the better I do, the better they do. So we've been doing that for 20 years, so they're real happy to do this. Recession-proof your practice. I don't know about you guys. I didn't go through a recession. Maybe y'all didn't either. But these people want to get it done regardless of the economy. Now, never diagnose. Joe talked a little bit about this morning. You don't diagnose. I never tell anybody they're sick because of their mercury fillings. I never tell them, when we get these fillings out, you're going to be better. I don't know if they will or not. Their body's full of whatever. I don't know what's causing their problem. I just know that they got a bunch of mercury in their teeth. And when I talk to them in general terms, I'm more likely going to tell them and show them on our intraoral cameras all the cracks in their teeth, and that's why this filling needs to be removed and replaced. Secondarily, we know mercury's not healthy. We know it's not good for us. But you sure don't tell them that their fibromyalgia or whatever the heck's bothering them is coming from their mercury. You can't do that. Number one, you don't know. Number two, you're not a physician. So don't practice medicine without a license. Joe mentioned that. Don't prescribe. Don't do chelation medications. You can't do that. Not in my state anyway. DMSA is a physician-ordered product. It's not a dentist thing. Now, some of the things I do recommend they do would be natural chelators, which I mentioned this morning, my cocktail. Do find an MD that's an alternative physician. Your general physicians will not understand what you're talking about. When you want them to do a mercury challenge test, they'll test their blood or they'll test their hair. If they're not a secretor, there's not going to be anything in their hair. If you haven't released mercury from a filling, there's not going to be in their blood. It stays in your blood 24 to 48 hours. You got to do a mercury urine challenge test. Now, Chris Shade has some other stuff too. He'll talk about tomorrow or Saturday that he's doing a different kind of blood test. But you got to have somebody that knows what they're doing, not just your general physician. And never promise improvement. I don't know if they're going to get better or not. They may or they may not. It's hard to say. They usually do. And follow the Iaomt protocols. And something we talked about earlier is our protocols for the accreditation are pretty ironed out, and you've got to do this, this, and this. But when I talk to the fellows or the masters in the academy, we all have a little different way of doing things. Some of us still use chlorella, and some of us use powdered charcoal. I personally use N-acetylcysteine and vitamin C. That's a hard thing to say. So does Joe, and it's easier. It doesn't leave a residue in the mouth. They swish it and spit it. I guess you could have them swallow it the first time. You wouldn't want it the second time. We do it when they sit down. Before we start, we do it, and then after we take the amalgams out, we have them do it. So, they wouldn't want to swallow that second dose because it's liable to swallow the mercury in their mouth, too. Use informed consent. Do provide patients accurate information, including opposing position. When I talk about root canals with people, I'm going to tell them, look, you want a root canal, fine, we can have that arranged, but here is what could happen from a root canal. You can have autoimmune problems, you've got this toxic tooth, blah, blah. We let them know that. Now, I use ozone therapy in root canals, and I do root canals, and a lot of my members here do them. Some don't. We haven't come to a conclusion in the academy about that. But I'll do them selectively, but with ozone. Is it the best thing to do? I don't know. Maybe not. But it's the patient's decision. It's not mine. Oftentimes, they want their back tooth out. Well, what if it was a front tooth? What if it was number 8? What would you do, a root canal or an extraction? They go, well, I'd have the root canal. Well, what's the difference? They're both toxic teeth if you look at it that way. And keep accurate records. We all do that as dentists anyway. Do not use alternative modalities. I think muscle testing is an excellent way to test people for products, but you can't do it. There's no science. You'll get killed by your state board if it ever came to that. I've got a friend in Winston-Salem area. He used EAV with a very skilled lady who did it quite frequently. He lost his license for, I think, 3 or 4 months by doing that from the state board. Does it work? Yeah. Is there any scientific validity behind it? Probably not. Probably, but there is. But you show it to us. Show the board the science and make them believe that. And maybe you'll be okay. It's not worth the risk. And treatment supported by science. This is our. I think it's confirmed. Is that our informed consent? I think I can't read that. It's a little fuzzy. Advertising. Now, we talked about Mercury-Free and Mercury-Safe. None of us are Mercury-Free. We can be Mercury-Safe, and that's kind of a gray area, too. I don't know how safe we really are. Most of the patients, as I mentioned, use the Internet and talk to our exhibitors at the booth. A lot of these guys have access to the Internet, have Internet websites that bring traffic to you. We've just worked real hard on our website with a company that's going to be here, too. Naren's company, Equa, who has helped us tremendously with our website, really has done a fantastic job. Yeah, so you got to also be careful with the Mercury-Free, Mercury-Safe. I don't care how careful you are, you still have fluorescent light bulbs. You're not Mercury-Free. And it's just some local publications that we advertise in. This is nothing new for you guys. Update your website. I'm sure you guys know a lot more about this than I do. I am not particularly computer savvy, but you got to keep things rolling in there. You got to keep your testimonials updated, pictures updated, so you keep your ratings up. Join the DAMs. That's an organization of ladies who have been poisoned, or I guess it's more than ladies, but at any rate, they're usually here selling books. This is a great referral source if you're a member, and if you're accredited, and if you're fellowed, you're more likely to get referrals because they know you know what you're doing. Now, we as an academy can't police anybody. We don't try and do that. But, the higher up you are in the ranks, the more likely we are to believe you know what you're doing and you're doing the right thing. And Tom McGuire, he's going to be here too. And the benefits. Camaraderie. This group of people would become family. It's always a pleasure to come and see my friends. It's all based on science. It's not our opinion. We have the science that Jack showed you this morning. The benefit of that, thanks to Dr. Kennedy and some people who work really hard to get that together. We have the continuing education. Twice a year we meet. We have Nuvo, our newsletter. As I mentioned this morning, you can branch out and do ozone training. You can become a naturopath, all within the confines of this group. Patient referrals, the newsletter I mentioned. better health for yourself, your staff, your family. Unique practice position. As I said, your selling position is a lot different. Biannual meetings, free access to Dr. McGraw. Is Tom still doing that? Okay, good, because this slide might have been last year's. I wasn't sure. Okay, and we have a mentor program, as I mentioned. As you see, my bottom tag here, I feel like an admiral in the South American Navy. But the mentor program is designed so if you guys have a problem, you can call the academy and they will assign you a mentor, meaning they're liable to give you my name. So you call me and I'll help you through whatever problem you're having. Well, there's a number of us doing this. I'm not the only one. Joe's one, and most of the older guys are mentors, or will be one if you ask them. But we're more than happy to help you. We want you to succeed. We want this to work. We want to grow the academy, help you, and help your patients. We want to eliminate mercury. So we're all about that. Mark Berkowitz is our chair, and I work with Paul Gilbert and myself to do that, and some other guys too. If you're not sure of the legality, check with the clinical practice committee. That's not really been an issue. And accreditation requirements. That's one of the things I'm here to get you to do. You got to take this course. You've done that. Attend 2 meetings. You got one already for sure. You got to take one more. Maybe you've been here before. Take an open book exam. We're not here to kill you. We're just here to make sure you're doing it correctly. It's not that difficult. The information is really, really fun to learn. Oral interview online or at our meetings. You just sit down and we just want to make sure that you are using the protocol. You are doing it, and you bring a couple case charts so we can review. You just have to submit an application, and with a special offer, right? Okay, what is a special offer?
I gave it out. I'd like to know.
Yeah, I'm afraid to say this is true.
They got it.
Okay. And join. If you're not a member, join us. Man, we want to grow the academy, and we want to spread the word and get accredited. And we've got a $50 discount if you're not a member to join the membership and become one. Become one of us. Okay. Yeah. Oh, can't back it up. Nobody knows. It won't back. There we go. Okay. So if you need to contact Joe or I, here's your information. There is going to be, and there should be on your desk after Dr. Kennedy's done, an evaluation form. We'd very much appreciate you filling that out. Oh, here's Dr. David Kennedy. He is one of the original members, I think, aren't you, Dave?
Yep.
Yes, and probably a world authority on fluoride, and certainly on perio, out of San Diego. This Dr. Kennedy was responsible for probably most of, or a lot of, the information in our library that he had, and could almost repeat without reading it. But a brilliant guy and a good man, Dr. David Kennedy. Woo! Woo-hoo! I'm going to let David hook you up there with the earpiece.
Okie dokie.
Thank you. Thank you.